Ready to roll? Good morning. Meeting is called to order. Notice of meeting statement, and I apologize. I was talking this morning. Well, the chief turkey for the state of South Carolina, we were in a conversation, and I asked him to hold my glasses, and he didn't give them back to me. So I'm going to ask, when it comes down to reading anything, I've asked Vice Chairman Woodhead to be Ed Miller when it comes down to reading. All good? All good. Thank you. All good? Good. Thank you. Sure. Notice of meeting minutes. Commissioner Corder. I have my glasses. You have your glasses.
Meeting notice announcing the date, time, and place of November the 16th, 2023 commission meeting was distributed on November the 15th, 2023 to appropriate media and other groups or individuals who have requested notification. The announcement and agenda were posted at the Department of Disability and Special Needs Central Administrative Office and on the website. The public has been notified that accommodations such as interpreters, mobility assistance, and other assistance will be provided to individuals with disabilities and special needs as requested in advance.
Once again, I want to welcome everyone, especially to our friend, Dr. Robert Bank. You have a beautiful last name, B-A-N-K. I think we all are familiar with that name. And on behalf of South Carolina Department of Disabilities and Special Needs, our state chair, Director Constance Holloway, on behalf of this commission, also the providers, the provider network throughout the state of South Carolina, the employees of SCDDSN, we welcome everyone to this meeting. At this time, we'll have an adoption of the agenda. I need a motion.
So moved.
Second.
Properly, Malphus, properly moved and second. All in favor?
Aye.
Opposes? Ayes have it, so ordered. Invocation, Commissioner Gary Corder.
Thank you. Pray, please. Heavenly Father, we thank you for all the blessings you give us and follow today as we make any decisions. Let us always look to the needs of others first. In Christ we pray. Amen.
Okay, approval of the meeting minutes from September 21st, 2023. Any questions, changes? If not, I need a motion to approve.
Second.
So moved. Second, all in favor? Ayes have it, so ordered. All right, programs and services. At this time, ladies and gentlemen, it is our honor and pleasure to have with us Dr. Robert L. The L stand for Lewis.
Yes, although my father's middle name was Luther, and they decided to change me to Lewis.
Wow.
So that's how it is.
Banks, and we have decided, state director, the executive staff, and the commission, along with our partners throughout the state of South Carolina, said that one thing we wanted to do was have the state agencies to come and tell us hello and bring those that are throughout the state of South Carolina with more awareness as to what mental health is all about in our great state of South Carolina. And we are honored and privileged to have you with us today. So in your own way, the floor is yours. Well, before I do that, Commissioner Thomas, are you there? Could you please, sir, introduce yourself to Dr. Bank? You're welcome. Dr. Banks?
So are we taking the podium?
Yes, sir.
Okay, all right. So I'll have my back to this audience.
It's up to you now if you prefer another location. It's up to you, but
I think we're okay. Okay. I don't want to have any special treatment, you know. So I think it's timely that our agencies are having a meeting today, and I'm hoping that this will be the beginning of a number of meetings between us, because it appears that we're going to become more neighborly. And so I'm sure that most of the audience has been aware of the issues of moving the agencies from these properties to a location in South Congaree. And so I think we'll have a lot to talk about in terms of working together. And maybe it'll be an opportunity for us to do good work. That would be a great thing. So I would say that given the time allotted here today, that I'm going to just give a brief overview of some of the things we do at DMH. But I would suggest that both in terms of all of the things we do and all of the things your agency does, we should get together and become more familiar with each other's services and mission, because we're going to be running closer together, it appears to me. So let me just say, I've been with DMH for a long time, let's put it that way. I left, I'm a psychiatrist, worked in the military for about 9 years, and when I left Fort Gordon, Georgia, I came over to Columbia because I had a few friends from the military who had come over to the Department of Mental Health, then the Hall Institute. And so I've been here since, let's just say the mid-'80s. And so I've seen a lot of things come and go, but I believe that we are all dedicated to the best service for our patients, and that we have a lot of overlap that we should take advantage of. So just quickly, Christy, are you still here?
Yes.
How does this work? Oh, this one. Okay, well, that would explain it, that I have the wrong one. Okay. All right, we'll take it off of there. Okay. Well, the audience would have to turn around to see that, wouldn't they? All right, so I'm just going to give you a brief overview of some of what we have at DMH. And I'm going to start out with the inpatient hospitals and nursing homes. Now, first thing I'm going to say is that the nursing homes are moving to the Department of Veterans Affairs. And when I leave this meeting, I'm going to meet with Marcia Adams to talk about speeding that up. So we have 5 contracted nursing homes, and they will be the first to be moved to the Department of Veterans Affairs, in that they don't have to take over the clinical operations. Department of Veterans Affairs is not an agency that's been tasked with clinical duties. And so we want to make this transition as easy as possible. So we have about 800 nursing home patients who are veterans of South Carolina. They do not necessarily have any mental illness. Some may, but they are regular veterans nursing homes that were developed by the state in order to provide an opportunity for veterans of only the state of South Carolina to receive care there. And so we've been operating from the first nursing home in the 70s on up to one that's just getting finished in Sumter all these years. So we're, I guess in a way, a little sad to see them go, because they're an important function, but we're following the instructions of our General Assembly, and I'm sure it'll all work out for the best. So it's interesting that we actually have more nursing home patients than we have psychiatric patients. on our inpatient facilities. So that 800 nursing home patients is in contrast to about 600 psychiatric patients, 200 of which are sexually violent predators. And that program was given to us by the legislature around the year 2000. And these are folks who have finished their criminal sentences but are not deemed safe to be on the street. So that leaves about 400, what I would call what you would expect to be the ordinary psychiatric inpatient, folks with serious mental illness that need inpatient care. So I would contrast that to our outpatient services, where 98% of our services are actually done at our 16 mental health centers. So if you think about the 100,000 patients we touch every year, only about 2% of those are inpatients that come to our facilities. And we do try to, for the most part, keep our beds at our inpatient facilities for the most seriously ill folks that need a longer stay. And we have contracted with a number of community hospitals to provide beds for those who are uninsured for shorter stays in the community. And last year we had over 1,800 of those admissions. So contrast that to just having 400 inpatients of our own. That would lead you to understand that most patients really need a shorter stay, not a longer stay. And they would much prefer to be in their community if that's possible, as opposed to coming to Columbia or coming to Anderson, where our inpatient hospitals are located. So let's see, if we go on to the next slide here, you can see how our general health centers are divided into sort of arbitrary regions, but we cover the whole state. We have, as I said, 16 mental health centers, and we have a clinic in every county. And we have contracts with all of the Medicaid MCOs, as well as the fee-for-service Medicaid agency, HHS. And Medicaid patients make up a large portion of the patients that we treat in our mental health centers. You probably know that having Medicaid doesn't necessarily get you to a psychiatrist. And so we try to make that a possibility for all the patients that come to us. We have, I just give you a ballpark, about 200 different psychiatrists that work for us. Many of those are not full-time doctors, and many of them only come to us by telemedicine. So it probably really equates to about 100 FTE when you're talking about the physicians. And then we have about another 50 nurse practitioners who can also prescribe medication. And that's how we populate our mental health centers. And of course, some of those doctors and NPs are working in our hospitals too. There's only about 750 psychiatrists in South Carolina. And I'd say about 100 of those are retired. Some people say that I ought to join that crew, but I'm not there yet. But we feel like we've done a lot of different things to be able to attract our medical professionals, and that includes regular state employment, contract employment. We have some long-term locum tenens doctors, a lot of different ways that you can be helpful to us. And I believe this really would apply to other agencies such as yours, that if we could develop a system where you could use some of the ideas that we've put into play, you might have more access to psychiatrists that you need. And telemedicine plays a big role in that. In fact, at this point, almost 40% of our psychiatrists and nurse practitioners are doing their visits by telemedicine. So that's the wave of the future. And if you expect to have providers, you need to be on that boat because it's already sailed. Let's see. I think probably what I ought to do is move to the last slide. Now, I didn't create this funnel thing here. One of my deputies was supposed to be here to explain this funnel, but really it's a way of depicting the idea that inpatient care is a small but important part of our care. In other words, like I said earlier, most of our patients are not inpatients, but if you need that kind of acute care, you kind of fit at the bottom of this funnel, right? And then as we move up, we look into crisis intervention, we look into standard outpatient care, and then we look at some of our preventive efforts such as school-based counselors and our suicide prevention efforts. Now, my deputy for community, Ms. Blaylock, could probably spend over an hour telling you about all this, but I'm not going to do that today. But as I said, we'd be glad to come back and meet with you and talk about our services and hear about your services. Might take more than one session, but it'd be great if we could do that. I think what I'm going to do is move away from services for a minute and talk about some things that are on people's minds today. As I walked up to the building here today, and of course earlier to my own building at DMH, I thought to myself, well, yes, these buildings have some age on them, but I wasn't quite ready to move out. But apparently we're going to have some discussion about that as the Joint Bond Review Commission has okayed the idea of our two agencies plus DEODIS and the I guess, public health part of DHEC moving in to a building together, which I guess some of us might suppose is at least a hint of what might be in some folks' minds about how agencies should be put together. I'm not saying that I know that that's what's going to happen, but one would wonder if there isn't some connection between the two to some extent. So if we think back to Senate Bill 399, which split DHEC and removed their commission, cabinet, they also, at that time, instituted a study to look at the agencies that I just mentioned. And that study has been ongoing by a group from Boston that are consultants in behavioral health. They were to give a report at the end of October. That report was mainly just a summary of all the people that they had gone out to talk to and gathered information from. Then there was to be a report in January and then a final report in April. I've heard some talk that they may move that schedule up and just do the final report the second week of January, but don't know that for sure yet. So the train we're on is moving, and it seems to be moving a bit faster than perhaps we had thought initially, but I think we need to all work together and find ways to determine what we think would be a good way for our agencies to work together, if not come together, so that we're ready to give input if we're asked. So I would propose that our agencies find some time to get together as we approach the holidays, even though those days are usually a little tight. People are busy with many things, but I don't know. well, let me put it another way. I think that the sooner we can get together and think about what's the best approach, the better positioned we'll be to answer questions. So I'm going to stop with that. The chairman said that we weren't going to have any questions, but I'm not opposed to a question if there are any. The audience or Director Holloway.
Well, no questions, but I will say that I'm in agreement with Dr. Bank that the sooner that we get together and decide collectively how to approach this. A lot of things are out of our hands, but a lot of things at some point they will come to us for insight on, and if we're on the same page. So as you said, our schedules are crazy hectic, but we're going to carve out time because this is very important to the people we serve, that this is done right. Not that necessarily that it's done quickly, but it's done right. And while Boston Consulting Group is impressive, they can't no more than someone like you who's been here. You wouldn't give me the exact date, but you said sometimes in the 1980s. So we're going to carve out some times for both teams to get together and thoroughly discuss how we think we should best move forward.
I think the collective knowledge of both of our agencies is immense, and we should take advantage of it and at least give our opinions about what we think might work.
And I want to personally thank Dr. Banks. We all of the directors get together. It had been once a month, but we kind of been, schedules have been not aligning, that we haven't been, but he's one of the first directors that kind of said, you need anything, Constance, you let me know. So I appreciate all of the wisdom and guidance he's given me thus far. It's very, very appreciative.
You share a good many patients.
Yeah.
And the best thing we can do is put our heads together and say, well, what's the best for this patient?
No questions, just a lot of thanks and a lot of appreciation that it's time for the agency to work together. The General Assembly thinks so. We think so. I think the stars are aligned, that we've got the right people in the right seats at the right time, that we're going to do what's in the best interest of the consumers and the consumers only. I want to thank you, Dr. Banks, for taking time. I know you got to get over to talk to Marsha about some other changes that they have us doing at the same time. We're juggling like 100 balls at one time, but we're managing. We're managing.
It is a lot of things at one time. That's definitely true. So I appreciate the opportunity to meet with you and appreciate this invitation, and look forward to working together to make things work as best they can.
Thank you very, very much.
Thanks, sir.
Dr. Bank.
And Christy, anybody who wants copies of these, feel free to give them to them, okay?
And you've enlightened us, and developing that working relationship is key and essential, and we agree with that wholeheartedly. You can't exit out this door so I can shake your hand before you leave. Let's give Dr. Bank a great hand and a great thank you. And South Carolina is up listening as well.
Chair, great to see you.
Okay, next item on the agenda. That was great. Does everyone agree?
Yes, amen.
What about the ones listening in? Oh, they can't. I know our Commissioner Thomas was listening, so Commissioner Thomas, you have any words? All righty. Okay, next item on the agenda is Commissioner's update. Well, we will start with Commissioner Malphus.
Thank you, sir. I just have a couple of very quick updates. One is, and this is actually because I have heard from a couple of, well, I guess you might call it constituents, but people in the public in the last couple of months. One is that It actually is in the minutes, but last month we talked about, David Thomas talked about, and we did in the minutes about the emergency hospital regional center transport, and I was just wanting to put it on the policy committee's agenda to hopefully get that looked into in January, since we're not meeting in December. And the only other thing is that I heard from somebody else about our, asking me about some things about our ongoing projects, and we haven't, and we voted, I think, in September or August to have some discussions about that by the end of the year, and so the end of the year is going to pass without us meeting, so hopefully we can deal with that in January too.
Thank you.
Thank you.
Commissioner Thomas. Right. Commissioner Coher.
I just want to say, I think that what we're doing with the meet and greet is a great event, and I'm looking forward to having some more.
Yeah, that was really, because we said, well, we would start with mental health, which was key. And there's, well, naturally now we're going to relax for Thanksgiving and Christmas, and then we'll hit the ground running real hard in January. So we have others coming from other agencies as well. I don't know the order. I know that DHHS, Dr. Kerr, and Ellen Weaver from State Department of Education, and DHEC, the list goes on, so that the public, the administration, those providers, all are aware that we are all in this soup pot together. And with that, I'll turn it over to the Vice Chair, Woody.
I have a couple things that I've done. So last year I encouraged my company, it's a national company, who, they bring awareness every month to certain minority groups. And they were missing last year the minority group about disabilities. So I highly encourage them to put it on their 2023 agenda, and they did. So October, they celebrated the Disability Employment Awareness Month. And I had the pleasure of being on their panel to talk about it. I was the only able-bodied member, but that's good because I could come in at it as a different perspective.
Exactly. What's the definition of able-bodied?
So, yeah, right? And I did mention, there's a, wide definition of, so it was a great showing. We had over 500 people attend, and I thought it was highly beneficial. So I was pretty happy about that. And I also second the meet and greets at the regional centers have been just a great step. I think that's really encouraging, the direction that we're going. And after this, I am marching my way to the Wheelchair National Championships in McDonough, Georgia. So I will be there till Sunday to see some great wheelchair tennis players. So excited for
Your
my
daughter is a tennis player.
Yep, so she's playing. I'll miss her. She's Go McKenna at 10
Go
o'clock.
McKenna. Everybody say go McKenna.
Okay.
All right.
So she's playing now, so I'll get to see how
Go,
she's
go,
doing.
go.
So,
Okay.
but yeah, should be some great adaptive sports going on.
Maybe your IT people can get that on the screen.
Yeah.
Yeah. Public input, do we have any? You do not. Programs and services. Tab 4. Vaccine Education Initiative. That's Mr. Keith, South Carolina Autism Society Executive Director. How are you?
Well, sir, how are you?
I can't complain, because complaining doesn't change anything.
Good morning, good morning, good morning.
You don't have any needles, do you?
No needles.
Okay, good. You can go
We don't
ahead.
give the vaccine, we just coordinate the vaccine initiative. But I want to thank the commission for allowing me to speak this morning to talk about the vaccine initiative. The Autism Society believes that improving the vaccination experience is a critical step toward achieving more equitable health care for people with autism and all neurodiverse individuals. Historically, people with autism and other developmental disabilities have a lower immunization rate than their peers without autism, leaving them vulnerable to vaccine-preventable diseases. Vaccine hesitancy is a long-standing issue with the autism community, and for many, vaccination visits can be stressful for a variety of reasons. In 2021, the Autism Society partnered with the Vaccine Education Initiative through a grant to address systematic barriers to care and promote vaccine education, confidence, and access. In 2023, the Autism Society later partnered with the Aging and Disability Vaccine Collaboration through the Department of Aging and some other organizations to increase access and intake for vaccines. So initially, when the vaccine initiative was initiated back in 2021, it addressed just people with autism. In 2023, they partnered with the Aging and Disability Vaccination Collaborative to include the BIPOC community, Hispanic, LGBTQIA, and rural populations with autism and other disabilities. So basically what's happened now, in summary, anybody wanting a vaccine can receive a vaccine. Through the VEI, we are working to address systematic barriers to care and promote vaccine education, confidence, and access. The Autism Society is seeking partners, healthcare and community who are interested in increasing vaccination rates and improving the vaccine experience. Partners will receive training and support from the Autism Society and its trusted national networks of affiliates. So what will we do? We will help train people in reference to healthcare training, our community partners, specifically vaccinating people and dealing with people with autism, because it can be a very hectic experience for them, sometimes overwhelming with stimulation, things of that nature. So we'll help educate our community partners, and we partner with other healthcare organizations. So for instance, we've partnered with Walmart, we've partnered with DHEC, the Low Country region of DHEC. We have a partnership with Lexington Medical Center. We partnered with VaxUp, because these are the entities that can provide the vaccinations. The Autism Society does not provide the vaccinations. We coordinate the efforts. We partner with organizations to ensure that the vaccines are provided. Those entities, like I said, your Walmart pharmacy, your DHEC, they have access to the national stockpile of vaccines. So they can order the vaccines and they can have the vaccines available. And this is any vaccine. This just isn't COVID. If someone wants a COVID vaccine, they can receive a COVID vaccine. If someone wants flu, if someone wants shingles, all vaccines are counted within this initiative, and all vaccines are free. So I want to make sure that everybody understands that all vaccines are free. We've had clinics we've had 3 clinics so far in the Low Country. We have another clinic this Friday and Monday in Charleston, and we are planning to have an actual clinic at our facility in West Columbia. This is through our partnership with Walmart, and they're going to come over and provide the vaccines through scheduling. So thus far, our goal is to give 600 vaccines, and that's statewide. Right now, we're probably about 100. The grant ends in April. So we're asking any of our community partners, any of our folks here that would love to partner with us. These are the entities that we can partner with that's on the screen. Disability organizations, healthcare organizations, hospitals, pharmacies. It's pretty much on the table. And again, we can either host an event, we can co-host the event, or we can become a third party. Now, what happens when someone comes to get a vaccine? I provided the commission one of our gift bags of a sample of some of the things that we give away during the vaccine clinics. We have fidget spinners. We have shades. Now remember, these are specifically or primarily for people with disabilities or people with autism. We have head-canceling headphones. And if you can't use any of this stuff, I'm quite sure you can find a child or somebody.
We're not giving it back.
No, I want you to keep it because if anything, you've got the bag and you can store things in the bag. But you get all kind of goodies in the bag, or the person receiving the vaccine gets all kind of goodies in the bag. And I tell you what goes over the best, we're able to provide a $25 gift card for everybody that gets the vaccine. That goes over very well. We don't even announce it, but we were down in Charleston at one of the churches, New Jerusalem Baptist Church, where we did a clinic down there. And when them folks found out that we were giving gift cards, our numbers went from about 25 that day to about 50. So it just increases. And they were very appreciative of receiving the gift cards. So we provide a sensory friendly environment for our folks with autism. We actually, when we are at facilities or at locations, we have an actual tent that is blacked out, and they can go in there, relax, calm down, because sometimes dealing with people, we say dealing with people with autism, if you've met one person with autism, you've met one person with autism. It truly is a spectrum disorder, because you can have some people with autism that will require 24-hour care 7 days a week, and you have other people with autism. Let me just mention a name, Elon Musk, who has Asperger's syndrome. He's on the spectrum, probably the richest man in the world. So it definitely is a spectrum disorder. And sometimes dealing with vaccines, they get very apprehensive, and we have methods in trying to calm them to ensure that it's a pleasant experience with the vaccine. I think, in fact, one of these things in here, just so you know, is a vaccine blocker. I think it's in here. It's in here somewhere, but it's a vaccine. This is actually right here is a vaccine blocker. So what it is put on the arm, it stimulates the arm, and they can't see the needle when it goes in. So, but these are some goodies for the commission.
But the needle still hurts.
No comment. If you're apprehensive about needles, it may be, but, something that's, vaccines are warranted and are needed. So, do I have any questions?
Well, you triggered when you mentioned autism. It brought back Senator Arthur Ravenel and the creation of South Carolina Department of Disabilities and Special Needs. Senator Alexander was there with him, and it was done for and with a purpose. And I imagine when he thought of it as being that one agency that would be able to help with those with disabilities and special needs. So I just wanted to make mention of Senator Arthur Ravenel. And he saw the importance of this being an agency, a standalone agency that could do those kinds of things. So thank you for bringing up that portion of it. Any other commissioners have thoughts, questions?
If somebody had an organization, had a planned celebration for Christmas or something like that, and they contacted your office, how long would it take to set this up?
Depending on where it's located and depending where one of our partners is located, it could probably be just a phone call. It probably can be, like we have an actual clinic that we're doing December the 9th in West Columbia at our location. But if any of our partners here would call us and say that they're interested in having a clinic, we would look to see the area that they're in to see if we've got a partner in that area. If we don't have a partner, then it's my job to go find that partner in that area. that can provide the vaccine. So it's very possible.
The $25, you take that with you, or that's something that you have to put through the mail? Because you
We
got
take it with
South Carolina
So,
listening.
right, good question. So anyone that gets a vaccine, we ask that they fill out a survey. And really the survey is it doesn't ask your name or anything like that. Really the survey is to make sure that we are addressing our target population. So I think it's 9 or 10 questions, takes maybe a minute, 2 minutes to fill out. Once they complete the survey, they can do it through a QR code. A lot of folks have smartphones. They do it on their smartphone. We actually bring out paper surveys also. Once they complete the survey, we hand them the gift card.
Boy, you got a lot of attention now. Any other questions? Senator Thomas, Vice Chair.
Yeah, for like, so you set up a day, like a day clinic, but what about like a shingles vaccine who actually requires a second series in it? So then I guess I heard maybe you would find a place where they could go for.
Right, so that would be coordinated through the pharmacist with the shingles, to make sure you come back and get that second. You can get that initial one at the vaccine clinic, but if it's, say for instance, if it's Walmart and, I don't know, Honeypath, then you make sure you go back to that Walmart and Honeypath and get that second vaccine. So thus far, we have not done shingles. Thus far, we've done COVID and flu, but any vaccine is counted. Our partners just need to know what vaccines to bring, because, a lot of times they have to stay refrigerated and under certain conditions. So they'll know what vaccines to bring, how many to bring, and that's what they provide. And then they complete the survey and we give a gift card.
Senator Thomas?
And that's where you're,
And
one's
don't-
over 50.
Yeah, and don't forget to fill out the questionnaire.
There you go.
You get your $25. If you don't want it, call me.
This is not age limited then.
Oh, it's not age limited, no.
State Director Holloway.
Thank you for being here.
I was gonna ask one question. I'm a little bit confused. Are you the director of vaccines for the Autism Society, or are you the director of Autism Society?
I'm the director of the Autism Society. The vaccine initiative is a grant
Okay, all right.
through the Autism Society, yes.
What would you say the number one thing you did as director of the Autism Society would be?
Oh, so we're flipping the script.
I'm just asking one quick question.
Okay. In my 2.5 years there, I think we've bridged the gap in reference to providing services for people with autism. We've become more transparent and more available within the community.
Senator Ravenel, appreciate that answer.
No problem.
Thank you, sir.
Thank you very much for coming. I will leave did you leave any cards?
I did not, but I can give them to Christy.
Okay,
Thank you
sounds
very much.
good.
Thank you so much.
All right, thank you. What's the next item on the agenda? You remember, I don't have my glasses. Number 11. Policy Committee.
Yes, I'm the chairman of the policy committee. We had a meeting on Tuesday and approved the procedure for reviewing policies, and it was approved unanimously, so I'm presenting it to the commission for approval. That's tab 5 and 6, 800-07-CP, and that attachment, and 100-01-DD. There was a little bit of controversy about this. I think we got it worked out. There was some concern about whether there's going to be a red line presentation, and it certainly will be. I always thought it was going to be, and there was some concern that it wasn't. As far as I know, it always was going to be red lines, so everybody would know what changes are going to be made. There was a control put in the proposal so that if anything happened in the commission, in the policy committee that was not approved in general, two commissioners could send it back to policy for review. So that is what was approved, and I'm now submitting it to the commission for final approval.
Okay, so it came out of committee approved?
Yes,
Voted
unanimously, yes.
unanimously. Okay, any further question?
I have one, in section B, I'm just trying to figure out whether this is gonna be in there or not. But in section B on page 1 of 807 CP, which is the, DDSM Policy Committee, procedure of review of policy. Under section B, it says, the committee, when the policy committee review is completed, a version, and it used to say, what the one we approved in 2018 said, including all recommended changes. I thought based upon the policy committee that I had to listen to, since I'm no longer asked to be on the policy committee, but it was hard to hear what David was saying, but I was trying to figure out whether those words were gonna remain or not, because if they don't, it seems like it doesn't, if they don't, it doesn't seem like the policy reflects what we're actually gonna do.
Director Holloway.
Can you tell me where you are again? Because I don't see it.
Section D,
In the attachment or in the full procedures?
the procedures under, the scope is the first thing, section D is the last thing. I don't have a page number, I'm sorry.
It's page 1.
Page 1 of that, policy, but it would be tab, it's of course under tab 6,
Tab 6. So 807,
right?
page 1, under committee scope.
Yeah, well, under B, the last paragraph.
The procedure for review B.
It looks to me like including all recommended changes is in blue, so it looks to me like that's gonna be taken out.
It's the attachment, right?
It's struck through.
It struck through, but I think, David, correct me if I'm wrong, but I think that
Including all recommended changes. Yeah, so you understand that B is around a version will be presented to the commission. Right, yeah, so we can add that back.
that's what I was asking, to add that back so that it would be appropriate
Sure.
based on
Yeah,
what.
That was actually agreed on Tuesday, but we'd do that.
It was.
Well, it just didn't come out different in the
I got you.
final version.
Yeah, we can add, if you guys will approve it with adding that back, we can add that back.
Yeah, well, I would be thrilled with that.
Okay.
I think that's a recommendation because that's what we agreed to this
It
morning.
is.
Yeah.
I think it was the intention all along, but I think somewhere in the mix of the approval, it just might have gotten a little screwed up. Because I think initially we were thinking that the commission would get all recommended changes if it hadn't been through policy committee, if it was coming directly to the commission. And what this says is regardless of whether it went through policy committee or it was a staff bringing it directly to the commission, they would both have the recommended changes highlighted. So that was our intention. We just missed it on
Commission will
that.
get a red line view of what's been changed.
Okay,
Sure.
all right. All in favor?
Aye.
All in favor? With the correction, yes.
Yes, with the
With the
correction.
correction.
Thank you.
Ayes have it, so ordered.
Thank you, sir.
She will be reaching out to you right
Tab 6. All right, any other?
Yeah, that was tab
We
6.
That was tab 6.
That was that.
Okay. Tab 7.
We're on tab 7.
Hold on a second.
Okay.
Oh, it is tab 7. I'm sorry. Go
Tab
ahead.
7.
Once again, that was approved by the committee, and if there's any questions about it, you can ask Ms. Manos. It was approved unanimously. It was a very simple change.
Got a motion and a vote, unanimous vote. Any questions? All in favor?
Aye.
Ayes have it, so ordered. Old business. Because I don't have my glasses, I'm going to ask Vice Chair Woodhead to read High Management's solicitation update, and it's not a motion or anything. I just need her to read
The
it.
other thing, we didn't approve 100-01 DD in the policy. That's the last policy. We didn't approve that yet.
Yeah, we did.
Yes, we did. We just
That's
did.
what we just did.
I thought the one right before that.
No, we just did.
We did 5 and 6 together.
Yes.
There's an attachment.
Okay, well, it needs to at least be said that it was done together then. Okay.
All right. Yes.
Commissioners, at the September 21st commission meeting, you may recall there was a motion to table the vote of the high maintenance solicitation that Ms. Janice Priest presented. However, after the meeting, Chairman Miller spoke to several agency executive team members and was informed due to the importance of timeliness of submission, approval should be considered immediately. Therefore, Commissioner Miller made the decision to approve submission of the solicitation. The minutes do need to reflect that this solicitation was approved for submission by Chairman Miller after the meeting in September.
Thank you very, very much. Tab 8, coming again from me. Would you read that one? Oh, you did?
That's
Oh,
me.
you did? Oh,
That's
okay.
it.
All right, thanks. Laurie?
Yes,
Okay.
right. So I'm back talking to you about the head and spinal cord injury drop-in centers. If you'll recall, in January of 2023, you guys approved a full year of funding with an update in July, which you were also provided, related to the head and spinal cord injury drop-in centers. As a reminder, there are 4 in the state: Charleston, Columbia, Horry, and Greenville. The initial development of those centers was around providing a place for people with brain or spinal cord injury, particularly brain injury, a place to go several hours each week with some limited on-site assistance. Initially, the centers were fully state funded. We ended up bringing in some Medicaid funding through rehabilitation supports. Fast forward a few years, rehabilitation supports could no longer be provided in those settings, so we've kind of transitioned some of those folks into waiver funding. The centers themselves are simply not able to be funded fully with Medicaid dollars. A lot of it has to do with the people who live in the area that might be able to support the center, right? So for services to people with intellectual disabilities, there tends to be enough of a population in a location to support a center for people to come and do whatever service would be available. For folks with brain and spinal cord injuries, the population is just so much smaller that there doesn't tend to be that. We do have a new service coming online, independent living skills. We have, as another reminder, we've had some issue trying to get the provider application up and going because we've switched from direct Medicaid enrollment to we've switched from DDSN being the provider of record to direct Medicaid enrollment, so it becomes a qualification process. Anyway, the good news about that is we hope to have that application up. Should I say by the end of the week?
I think that you can say.
Hopefully by the end of the week, the application will be forward facing on the website so that we can begin to have providers apply to become independent living skills providers, as well as all of the other services that DDSN offers through waivers. Once we get providers on board, we're still going to need to do training and onboarding and we have the approved service standards and that kind of thing. You guys have already looked at those, but the issue is these centers are going to need state funding at least for another year for us to get that service up and going. And if we want to continue that center-based approach in these four areas, they are likely going to need some level of state funding forever. So I'm bringing it to you and asking for at least a recommendation of another year of funding, right? Starting in January of 24. I can provide you an update in July like I did this year. Hopefully it'll be a little more, independent living skills will be up and moving, and we'll kind of figure out those services. But I just want to say, I'm not sure that if we continue to have physical centers, that there will never be a need for some state funding for that. So, questions?
Should we move to think about, I'd imagine this would be like a non-recurring request then again? I mean, is there any consideration that we should make it a recurring request from here?
I would like to have a year of implementation of independent living skills, because I think the question becomes, well, I think there's a few things to really tease out, right? There's 4 centers. Many of them have different things going on. But a center is not available for every person with a brain and spinal cord injury in the state, because these have never been anywhere other than the 4 locations there are. The idea with independent living skills is we get that same kind of service in a one-to-one basis out to people no matter where they live, right? So I really want to get some data around how many people can benefit from the one-to-one service that won't need the center-based approach before I make a recommendation to you for it to be recurring, right? So that's kind of my thought process. That's why I'm not coming to you asking you for recurring, because I really want to get some time behind us where a new service is implemented and we see if that new service meets the need, and then how many people we actually have in each location. So that's my thought.
That makes sense.
Good thought. And also, we wouldn't know how much to approve money.
Correct.
If you didn't do it your way.
Right. Well, I think that's part of it. The other part of it is, do we need a center in those 4 locations, or can we replace that with one-to-one service for anybody who needs it once that year happens, right? But I also think there's always going to be people who want to choose center-based services. Part of that is socialization, other peers. I like to go to the center because I get to see people. The question is how many, and how, because the independent living skill service is not a group service, it's a one-to-one service. So the question is how many, and is it a good use of the amount of money it costs for the number of people who want to go, right? Do we want to spend $50,000 a year so that one person or 3 people get to go to a center? That's a question, and we'll just kind of have to weigh the options at that point, or is there a better use of that? So that's my thought.
So with hopefully the application will be out, how is that being communicated to people that would be providers of the independent living skills?
So we have kind of a list of people that are interested in doing it that are not current providers. And so we'll email them and let them know that the application is up. We also can send a communication to our current providers who may be interested in adding that as a service. But we want to make sure we have it up before we do that.
And eligibility is on there too, like what the requirements are for eligibility.
The application is very complete. It says exactly what you do. We are trying to write kind of a little, where we're forward facing it on the website. We're trying to write some little basic instructions, like email address, where it goes, because it's in the application, but just so that people don't have to do everything and then go try to search for where they, what email they send it to, and a phone number for if you have questions, that kind of thing. So we're really excited.
Thank you very, very
Great
much.
responses.
But I do need, I need a motion and a vote related to, because December 31st of 23, the funding runs out. So we need to be able to issue funding starting January 1st.
Well, the last question is it the same level of funding we
Yes.
had, we approved last year?
Yes, it would be.
So I need a motion.
So moved.
At what level again? I'm sorry, I missed the number.
I think, look, you would, yeah, I'm not
We need to
sure.
know what the motion is first.
what I'm saying.
It is $28,000 per quarter per center, right? So it ends up being $112,000 per quarter for all four.
Okay, so how would you state the motion?
I need a motion to fund the head and spinal cord injury drop-in centers from January 1, 2024 to December 31st, 2024 at $112,000 per quarter
For all three centers? Yes.
for all four centers.
All four centers, sorry.
Okay, so you're in agreement with that?
I don't disagree. I'll second her. You made a.
I'll put a motion to fund the head and spinal cord drop-in centers for year 2024, for the 4 drop-in centers at $112,000 per quarter.
Thank you. I'll second.
Motion and second. Question? All in favor? Ayes have it, so ordered. All right, I just have, the state director have to leave, and if you don't mind, Quincy, we'll let state director, if that's okay with you, if that's okay with the commission. Mr. Quincy, you good with that?
I'm good with that.
Okay,
Thank you kindly, sir.
we got a baby waiting.
Yeah, I have to leave. I have to take a sick child to the doctor. So, good morning, everyone. Thank you for giving me a few minutes to talk. I'm gonna try to get through this without losing my voice. Since we did not meet last month, I'd like to include both remaining regional centers in the employee spotlight for this month. Salibi has chosen James McFadden and Timothy Hinkle. James has worked for Salibi Center for more than 16 years and is currently serving as a residential manager. He has proven himself to be a great leader, and his employees and the individuals he cares for are all grateful for his compassion, kindness, and gentle soul. Timothy started at the Salibi Center in September of 2017, following 27 years of experience with the Department of Developmental Services in Connecticut. A year ago, he moved to a position in administration and has quickly become the backbone of the front offices. Additionally, in recognizing Salibi, I'd also like to recognize this month employees from Witten Center. Witten has requested that I recognize Robin Elsmore, who is the Director of Consumer Reports. Robin has been at Witten Center for 42 years and is a valued, reliable member of their team. Facility Administrator Craig Bird says that she is his right hand and is always focused on what is in the best interest of the residents of Witten Center. Before I get into more agency updates, I'd like to quickly recap. You heard Dr. Bank speak to it earlier. On Tuesday, the Joint Bond Review Committee, referred to as JBRC, approved the first step toward moving DDSN's central office to an office in Casey as part of what they're referring to as a healthcare agency campus. The Department of Administration is overseeing that project. If approved, we would be joined on the campus by the newly created Department of Public Health, the Department of Mental Health, and the Department of Alcohol and Other Drug Abuse Services. The lease was approved to begin on July 1st, 2024. The move is contingent, however, upon the General Assembly appropriating $36 million in recurring and non-recurring funding in the budget to fund the move. We will continue to follow progress and keep everyone informed as new information becomes available. Next, I'd like to cover some agency updates, starting with our Quality Management Division. Last month, staff presented during a session at conference with the South Carolina chapter of the American Association on Intellectual and Developmental Disabilities. Additionally, Janet Priest and Ann Dalton are attending the National Association of State Directors of Developmental Disability Services, which is referred to as NASD. They're currently there. I was supposed to be there, but I was under the weather and decided to stay here in South Carolina. But Ann and Janet are there and participating in all the conferences that they have offered for this week in Virginia. Lastly, Quality Management staff awarded a new 5-year contract to Alliant to continue monitoring our community-based providers for administrative compliance and individual services, licensing reviews, and observation of residential and day services settings. Elsewhere, our HASC division raised more than $1,000 for their South Carolina Spinal Cord Injury Association via bake sale, and I missed the bake sale. I was devastated, but I'll talk about it later. The month also included internal observation through contests and share inspirational stories of those with SCI who play adaptive sports. Additionally, externally, we posted on social media and coordinated interviews with media that resulted in positive stories. These stories included interviews with our HASC director, Melissa Ritter. Similarly, our employment services folks celebrated October's National Disability Employment Awareness Month through internal articles and contests. And externally, we also had media coverage by connecting reporters with our employment services director, Susan Davis, as well as with families who work with us and our providers to find employment. Our autism division is still hard at work. They included trainings among staff at regional centers and law enforcement agencies to include Charleston, Columbia, and Rock Hill. Additionally, our autism director, Stephanie Turner, accepted position on a newly formed community advisory board headed by USC's Carolina Autism and Neurodevelopment Research Center. With our engineering and planning team, we received phase run approval from the legislature for our $12.6 million year one capital improvements project. This is the first step of many to get a full approval. It includes about $2.8 million for coastal renovations, $3.3 million for Midlands, $3.1 million for PD, and $3.1 million for our Witness Center. Just a couple more items. We did participate in the South Carolina State Fair last month. This was our first participation in the South Carolina State Fair. We were there on October 19th for the sensory friendly morning, and our friends at the fair estimate more than 3,000 people with sensory needs attended, in part because of our promotion and attendance. The communications and transition teams staff handed out informational resources during that day, and HR staff worked at the table that afternoon and promoted hiring. It was a fun event that did a lot of good for our agency. Lastly, I'd like to shout out Central Office and Midland staff for collaborating on our indoor trick-or-treat for residents at Midlands. Last month, I believe it was Halloween Day, residents from Midland came over to Central Office. This was an idea that was spearheaded that came from Tricia Richardson with the HASC division. And Central Office staff had a great time passing out treats and goodies to Midland's Center residents. It was super cute. There are probably about, how many would you say, Laura? Probably about 60 residents that came along with the facility. It was great. It was a great event. Kudos to Tricia for having that idea. I think the consumers enjoyed it, and I personally enjoyed seeing all the costumes. Our FA himself was Ken. Gene Bowman was Ken from the Barbie movie. He didn't have a Barbie. He said no one was willing to be his Barbie, and I said, you should ask me. But that was a great event that provided a lot of cheer for the residents. And that's all I have. I'm gonna head out to tend to a sick kid.
Okay. Before you leave and before Quincy comes out, I just want to take this opportunity to thank you as a state director and thank the entire executive staff. You're doing a marvelous job, as well as every employee that's employed by South Carolina Department of Disabilities and Special Needs, and also to our partners, the ones we met with.
I'm sorry, there's a lot going on in the last 2 months. I neglected to mention that in October, we had our meet and greet here. I was not in attendance of that. I think I was at the hospital at that time with my father. But in November, I did get the privilege of going down to Coastal and we met with providers. We're gonna do next year, we're gonna try to plan, not with just the DSM boards, but with all of our providers, some similar meet and greets. I have found, and I hope that the providers have also found these to be very productive and enlightening meetings. It's an opportunity for us to share thoughts that we wouldn't normally necessarily get to share. As a result, we have decided to do a couple task force. So I appreciate all of the DSM boards and their chairmen or the board members who took the time to travel across the state to come meet with us.
It was excellent and extremely productive. The partnership is moving along, and Laurie and Janet and the rest of you that attended, Rob and whomever else, and especially to the commissioners. It's well worth it. And it gives us the opportunity to work closer together because their inputs are just as important as ours. Again, appreciative, and you better go ahead and take care of your needs. Dr. Quincy. Man of the hour.
I'll be brief. So under tab 9, you're going to see the year-to-date performance of the fiscal year 24 spending plan in the amount of $327 million. So through October 31st of 2022, the agency spent approximately $109 million in agency cash, which puts the agency under the commission-approved spending levels by approximately 0.01%. So we're right there. Also wanted to update you on this year's legislative pass-throughs. We receive funding around the end of September each year, and we distribute those funds to entities listed under Section 18 of the Annual Appropriation Act. So that bottom section you see with the $6.8 million. So through October 31st, we sent out $6.8 million. In order to send those funds out, DDSN must collect some information from these entities based on requirements in Proviso 117.21 as well as Executive Order 22-19. So that bottom box just kind of gives you an update on where we are. We're hoping to have all of those funds allocated out by the end of November. I think we're still, my budget team is saying we've got one more we're still waiting on some paperwork on. So we'll have those cleared the books and skis. So that's all I had really, unless you guys have questions about
Commissioners,
Where we are?
I just wanted to ask you an important question, not necessarily here, but before I leave here today, if you mind giving me just 5 minutes, that was something I wanted to ask you about.
Yep.
I did receive a text from the Chief Turkey of South Carolina.
That.
Chief Turkey.
Who's the Chief Turkey?
Thanksgiving is coming. And Chief Turkey said that he sent all of the turkeys on vacation. So if you haven't gotten your turkey, you're in bad shape. But I did ask the Chief Turkey that, does the governor, our friend Governor Henry McMaster, have the authority to recall those turkeys? And he said yes. So the turkeys may have to be recalled. If you get to the grocery store and you don't have a turkey, we'll recall some. Can I get an amen?
Is that the same person that took your class?
Yes.
Okay.
He took care of that. He have it outside. I'll meet him when I get out there.
Okay.
All right.
Thank you, Quincy.
Next regular scheduled meeting is January, what's that, 18th? Am I correct?
Yes.
2024, that's the new year. So when we return, it'll be a new year. Again, thank you all, and on behalf of this commission, continue to do the work that you've been doing and is helping those with disabilities and special needs for our great state of South Carolina. Can I get a motion to adjourn?
So moved.
Second. Meeting adjourned.